So our next topic is how to assess when a person has their most stress periods of their symptoms during the 24-hour period of time. So we know that there are 12 sets of meridians. 6 of those are what are called yin meridians and 6 of those are yang. For every yin there's a yang or a couple with these. So we know that there are 6 pairs or 12 meridians altogether, which every one has a 2-hour period, which means we've got to cover 24-hour periods. And this will help us to find out when the most stressed period is with a person and which meridian to start and how to go about treatment. So we want to really get into the patients where their symptoms are. So we have a person here who wakes up at 3:30, was it, in the morning? Which is 3:30 is coming into lung time, isn't it? Lung time. 3 till 5 in the morning would be lung time. So we think, well, maybe she's going to show positive on the lung meridian. So we're going to use the alarm points, but we're going to use the umbilicus, first of all, as the source of where the energy goes in, or the chi. So we're going to use 2 pointing, which basically we're using one as a reference point and the other as the object beam, which if you look in David Walther's books on applied kinesiology, describes very, very well as far as the holographic or hologram of how the neurological system works. So everything is in relationship to this. How do you like that? So we would say in relationship to weight, and as we put it on the tongue or on the body, how do you like that? So it's always 2 aspects. So what we're going to do here is we're going to test a strong indicator muscle. Again, we use a rectus femoris because we need both hands available. Okay, so it's best to use leg muscle, nice and strong there. We're going to test her now time. So at the moment we are 10 to 4, which means we're in bladder time. So let's therapy localize the bladder meridian. Remember, just above the pubic symphysis. Make sure her body clock is in time, which it is. Okay, now we're going to put a finger in the umbilicus. So you use the left hand, index finger. It doesn't matter which finger, but just most people are okay, but occasionally you get somebody who's sensitive about putting their finger in their tummy button. Okay, so just ask them, is that all right? Okay, is that all right? Okay. Now the other hand, you're going to put 2 or 3 fingers on, particularly with the body point, onto the large intestinal alarm point, which is just 2 inches, 5 centimeters lateral to the umbilicus, in that groove between the rectus abdominis muscle and the oblique muscle. So it's on that part there. So exactly lateral. So we're going to start off first thing in the morning between 5 and 7. Okay, so no problems in there. She doesn't go weak. Then we're going to move to stomach time. Stomach alarm point is halfway between the xiphoid process and the umbilicus. Okay, then we're going to move to the spleen. Spleen meridian is on the tip of the 11th rib. Follow the lower costal margin round. Some spleens are here, the 11th rib, and some are much further round. Mine's there. So usually they're somewhere around that area. Okay, spleen. After spleen comes the heart. The heart is on the tip of the xiphoid process, so right at the bottom of the xiphoid, not on the xiphoid, but just underneath it there, which is 11 o'clock in the morning till 1 in the afternoon. Then we're going to go 1 till 3, which is small intestine. This is just above the bladder point, so about 2/3 of the way between the umbilicus and the pubic symphysis is small intestine. This is lunchtime. And then we're going to go on the bladder. So although we're going on the now time for her at the moment, we're talking in reference to the umbilicus or the energy field, not just the now time. So bladder. Okay, splendid. So everything's strong at the moment. Then the kidney. So hand around the back here. If the patient can't get around, it's on the tip of the 12th rib. If the patient can't get round, you go round and you give it a good rub yourself. Okay, just to stimulate it will be enough. But it's ideal, it's better if the patient does that. Kidney is okay. And after the kidney, which is 5 till 7, we've got circulation sex, which in the male or female is between the nipples on the sternum there, right in the midline on the conception, is okay. Then the triple warmer. So triple warmer is halfway between the umbilicus and the pubic symphysis. So it's above the S, the small intestine. Can you usually remember those because it's TSB, okay, which stands for 3 small buttons, or the trustee savings bank, doesn't it? Okay, so now triple woman. After triple woman comes, let's say 11 o'clock at night, comes gallbladder. Gallbladder is in the space of between the 7th intercostal, just the last intercostal space here before. Okay, so now we're sweating. Okay, we've got 2 to go, and we've got 2 positive meridians that haven't come up yet. So liver, that's in the 5th intercostal space. These are bilateral, so it doesn't matter which side you're doing. So that's the first one that's gone. Okay, and then the lung, which is on the coracoid process, lung 1 on either side, is going to be the other one. Yes, okay. The dreaded 2, so often these come up. Maybe in 1 in 10, 1 in 20 people, it's going to be those 2. They're really, really important meridians. And yet they're when we're asleep. They're most active. But of course, what they do is they wake you up. You said 3:30. The previous lady said, I don't know what time it is. The trouble is on dark nights, you don't know what it is because you can't read it. My way of knowing is it light? Can I read the clock? In which case, it's obviously early, coming towards getting up time. But the mere fact of leaning over or pushing a button or putting the light on wakes you up even more. And that's not good because the light fires into the pineal or through the eyes and affects the pineal and suppresses melatonin, which makes you come awake. Okay, now, which of these 2 is, if you like, the more important one? Now, when we look at a person, we have 2 issues with a person. We have the issues up front of what they're complaining about, right at the moment, okay? In other words, the expressions of their genes, of how they're displaying that. And then you have their constitution, or what's called in genetics genotype. So the genotype is what's written more in stone about your body type and your gene expressions, okay? Now, these can be modified. They, with some real hard work, can be altered. You fill yourself up with mercury, you soon alter your gene expression and things. You become nicely deficient in something like oxygen, and they won't express themselves. So genes can switch on and switch off, they can change. But generally, your genotype is more, think of it as your constitution this year. But your phenotype is how you're expressing those genes right now. Okay, so in other words, which one is the more important one? Which one is the one that she's displaying at the moment as far as her symptoms? In other words, she's got an infection, so which genes are not working, which genes not? She's got some other, she's got an allergy perhaps. This is a result of something more fundamental, but nonetheless she's got an allergy to, let's say, to eating wheat or whatever it might be, but that's not the cause, that's the effect, isn't it? So think of these 2 as genotype and phenotype. So genotype is what's more written in stone as far as your book of life or your gene program there, and the phenotype is how those are being expressed at the moment. Are we expressing, taking the caps off certain genes and letting them express which we don't want to, or are we keeping the caps on certain other genes when we want to take them off and get them expressed? So now where did we see all genes, all problems come from? Is from the emotions. So we're now going to introduce another phrase which is called the unconscious. So remember we talked about conscious when you listen to what I'm talking about, process that information, have a think about it, argue about it. That's conscious thought process. Subconscious is just receiving that information and putting it into your database, which can be retrieved and programmed in that we do things automatically. When I went for a cup of tea there, I went in, poured my hot water, and sat down, and Harith and I had a talk. I don't even remember actually going to the urn and getting the water out. You did it automatically, didn't you? You know, it's like driving to work. You get to work and think, oh, I'm here. I've gone round that roundabout, or 10 roundabouts, through those traffic lights. Were they green? You can't remember. Everything is automatic. That's subconscious programming, which we learned or inherited certain aspects in. We don't learn to breathe. It comes, you know, it's automatic. So they're inherited factors. Now, the unconscious are things basically that we're unaware of. That's why they're unconscious. They're not in our field of awareness. And a lot of those thoughts, psychologists say at least 2/3 of our thinking is negative. So most of these unconscious thoughts that come into our minds are negative. They're things like guilt, apathy, greed, pride, anger. And we go through a lot of these every day. But some people are running a particular program at any one time, all the time. And you sort that one out, and then they run another one, and another one. We've all got a bit of this in us all the time. We all got a certain element of anger. There's a certain element of grief and a certain element of pride and so on in all of us. But it's just a matter of which one of all those is displaying maximally at the moment. Each meridian has emotions attached to it. And primarily the negative emotions are those that calibrate sort of low in the levels of consciousness, and we're going to work out which one it is. Now it happens that we've got two beauties here. So the two beautiful meridians that we've got here is the liver and the lung. Now the lung is associated with anger. Okay? Now some of you will say, I thought it was the liver. In Chinese medicine it is indeed the liver, but when we test this with kinesiology techniques, we found over many years now it's associated with pride, and the lung meridian is associated with anger. But this is not usually expressed anger or expressed pride. So angry people are angry, and you know that when you talk to them, they're best avoided. Don't get into conflict with them. But the worse than the expressed anger is unexpressed anger, when they're angry with themselves. So they're fighting continually against themselves and everybody else in there. They're just angry people. But the pride is not so much pride of I'm better than you, or arrogance type of pride. It may be, but most of it is hurt pride. In other words, somebody's called you something or hurt you. Okay, and the hurt pride is a difficult thing to come to terms with. It really upsets you, and it manifests through the liver meridian. So when we get inspiration, when you think about inspiration, you put your eyes upwards, don't you, to heaven. So in other words, you look upwards. And looking upwards takes you into a higher field, or what's called accessing the superconscious, which is the higher level of consciousness within each of us. And in the same way, when you look down and you hang your head down like that, it's usually because you're pretty depressed. So when your eyes go down, you access your unconscious mind. When you look up, you access your conscious mind. Okay? So what we're going to do here is we're going to start off with one of those meridians. So it doesn't matter which one. Remember, one hand in the umbilicus, the other one on the liver. And we're going to make sure she looks above herself here, first of all, and just make sure we're in weakness. And then we're going to ask her to look down. So you can look down and hold the eyes in that down position. Okay, so she doesn't alter in any way. Then we go to the lung. And now look down. So we see that looking down alters the lung meridian, but not the liver. Okay? So we would say here that the liver is the phenotype, is what she's expressing at the moment, and the lung is more the genotype, probably the one associated with more the emotional component. And when we come on to dealing with the emotional component, how we deal with that is up to the skills that you've got in your training. We will give you and guide you through the numbers of techniques that we have involving aromatherapy, colour therapy, working on the trigger point of the muscle associated there, emotional stress reflex points, music therapy, all sorts of things that we have at our available to help the patients with their emotional problems. Affirmations is the other. Okay. So at the moment what we're going to do is we're going to start with her liver meridian, because that's her expression of her genes at the moment, or the phenotype. That's where most of her symptoms will be coming from. Her genotype is where the real core of her problem is. We may want to treat her on both of these in the first session, or we may say we'll deal with one of those first and then deal with the other one next time she comes. Okay? It doesn't really matter, it's not a game, but the more you can get information from a person at this stage, the better, and the more you can treat them. So our approach here would be to treat the liver meridian first, and then the lung, and then finish off with the emotional work associated with the lung or the genotype.